I have been given this very interesting topic of the health impacts of air pollution from road transportation. And my organization has been working for 20 years in this region. We were established in 2001 by the Asian Development Bank, the World Bank, and USAID. And I just want to go directly into the what the science shows of the air pollution emissions inventory of sources in the Philippines. And this was just recently presented by our Environmental Management Bureau of the DNR, just actually a few days ago. And their emissions inventory shows that 73, close to 74% of emissions come from mobile sources or motor vehicles. The rest come from industries and area sources such as open burning. So truly a significant portion of the pie of air pollution sources in the Philippines comes from motor vehicles. And a Health Effects Institute study, so this is HEI, is based in the US, very early in the decade. So in 2010, they had already identified that the high exposure zone, if we're talking about traffic related pollution, is the 300 to is up to 300 to 500 meters from highways and other major roads. So they made a calculation of the exposure area in North America, and that reached up to 45% of the population. So it would be interesting to see if we were to plot this on our maps, on our street maps, what is covered by a 300 to 500 meter high exposure zone, no, from our highways and major roads. And these would be people, the people living in these areas are have higher risk than those beyond these areas. So another slightly more recent study was done by the ICCT, so the International Council for Clean Transportation, also based in the US. And they looked at what was the impact in terms of premature deaths from particulate matter 2.5. So these are fine dust particles that can enter your respiratory system, but could also enter your bloodstream. And so what they found out is that in the largest economies or countries, so you see here India and China at the top, and even Indonesia here, the significant transportation attributable PM 2.5 and ozone deaths per 100,000 population. So, and then I dive a little bit more into their conclusions. So the study actually links vehicle tailpipe emissions to about 360,000 premature deaths from ambient particulate matter 2.5 and ozone worldwide in 2010, and a much higher figure in 2015. So this is quite significant, as it is close to 12% of global ambient PM 2.5 and ozone premature deaths. And if we can, of course, as would be expected, about 70% of these deaths occurred in the 4 largest vehicle markets. And they make particular mention of on-road diesel vehicles and the exhaust that come from these vehicles as being responsible for nearly half of the impacts worldwide. And they even put a dollar value to the health damages globally, and it's in the trillion. So maybe we should look a little bit deeper into what are the health impacts of air pollution. Studies have already shown that almost all systems within the human body can be affected. So in this graphic by the European Environment Agency, from the central nervous system, there are impacts starting there up to, of course, our respiratory system. We would attribute asthma, reduced lung function, COPD, and lung cancers. But what's interesting and worrying are that cardiovascular diseases have also been attributed to air pollution and impacts on the blood, liver, and spleen, and even the reproductive system. But the story doesn't stop there because, as we know, there are sectors in our society that are more vulnerable to the effects of air pollution. And here is a graphic, an infographic that shows how air pollution is the unseen threat to children's health because it can stunt brain development. It can reduce lung function and trigger asthma, and as they grow into adulthood, they can develop cancers, chronic respiratory illnesses, cardiovascular disease, and stroke. So what our Clean Air Act says, the Philippine Clean Air Act, is that every person has the right to clean air, and definitely children deserve to breathe clean air. So here is another graphic from the WHO also emphasizing that studies now link exposure in the womb of a pregnant mother and exposure in early childhood can lead to all of these devastating impacts to the child and can bring these ill effects into adulthood. And so if this is not a strong reason or rationale to act urgently on air pollution, then I don't know what is. So in the Philippines, estimates also from the Health Effects Institute say that a high number of deaths caused by air pollution can be found in the largest countries with the largest populations in Southeast Asia, and including the Philippines, where about 70,000 premature deaths from air pollution is estimated. So just some final thoughts. Cities such as Metro Manila are places with dense population. So we have a huge number of people living, working, and seeking entertainment in these dense cities. And there's already very strong evidence of the health impacts of traffic-related pollution and of air pollution in general on people, and especially on vulnerable groups such as children, the elderly, and those with existing illnesses. Therefore, we must plan our cities to protect public health because clean air and safe air is a human right. We have the right to breathe clean air. Thank you very much for the opportunity to share this with you. And I just flash here my email address and our organization, Clean Air Asia's website, in case you'd like to get